A lot of these Republicans want to slow the growth of entitlements like Medicaid and Medicare. Not cuts, slow the rate of growth over a period of 5, 10 years. What's wrong with that?
Well, first of all, let's be clear that they're not just slowing the growth of entitlement. What they're going to do to the Medicaid program is actually try to throttle it and end Medicaid as an entitlement, especially to people who are working hard in America but at low-paying jobs and are otherwise relatively healthy.
Wait a second.
Let me just finish.
That is not the fact. Okay?
No, that's the people.
They will argue they're slowing the rate of growth. Let's just be clear on that. Do you
it's not. Listen. It's not important what they will argue. It's important what the facts and the consequences are going to be.
We'll see what the bill says. The facts will be in the bill once we see it.
The consequences. No, the consequences, according to the Congressional Budget Office, are that you're going to throw 22 million people off. Now, remember, if they in fact modify it a little bit, the estimates are that they'll still throw 17 or 18 million people off health coverage, and most of those people are hardworking Americans.
Language, and you know it's not throwing people off. You don't know who
it's removing coverage
million,
from them.
I'll make my point, then I'll allow you to go again. It's not 17. You don't know who the 17 million or who the 22 million are. These might be young people who don't want to buy the insurance in the first place. Now, come back to another central question.
Wait a second. No, I can't. We can't leave that with your false assertion. It's not that young people don't want to buy health insurance. It's that the affordability is a problem. And this bill does not solve the affordability problem. As a matter of fact, it makes it much worse for two groups. One is hardworking people who are on low-paying jobs where their employer doesn't offer insurance. It removes them from Medicaid. And the second is older people above the age of 50 who will have increased premiums and lower subsidies to get insurance. Those two groups really suffer under this bill.
And a lot of Republicans would argue that's rhetoric. Now listen,
that's not rhetoric. The Congressional Budget Office,
allow me to ask
head by a Republican, said that.